Scene safe. I got PPE for me and my crew, my environment. Where am I being dispatched to? Or I'm being dispatched to. There's a skate park in Lakeside. I'll just say I'm being dispatched to the skate park for a reported, skateboarder down. I'll say that. Number of patients. Looks like I have one patient due to the call notes. I'm gonna run this as a mechanism of injury due to him falling off the skateboard. Additional resources. Call for ALS if needed and cancel if I don't need him. Need for C-spine, partner, go ahead and hold manual line stabilization. So general impression, looks like I have a mid-20-year-old male laying supine on the ground, fully alert. Doesn't appear to be in any obvious pain at the moment. I'm going to go ahead and assess his level of consciousness and if there's any apparent life threats, which as I can see right now, I'm not seeing any apparent life threats. Hi sir, what's your name?
I'm Ben.
Ben, how old are you, Ben?
24.
Okay, I got some questions for you. What city are we in right now?
San Diego.
And what year is it?
2025.
Okay, so right now I can tell my patient he's fully alert and oriented times 4, answering all my orientation questions appropriately. His airway is paid and maintainable. He speaks to me in full and clear sentences. Breathing seems to be about 20 times a minute, full and effective. I would go ahead and check for his oxygen here. And I can also do just check for cap refill. Cap refill seems to be immediate, and I can delegate a pulse ox if I need to. Skin seems to be pink, warm, and dry. I would do a quick blood sweep. I'm not seeing any obvious bleeding right now, and then that's all I'm seeing. The skin seems to be pink, warm, and dry. So right now I'm just due to my patient, him falling. It sounds like he did take a pretty good fall per bystanders. I would make him a priority patient, want to transfer this time. I'm going to go ahead and want to package him up for spinal precautions though. So with that being said, let's go ahead and get a backboard. We'll get a C-collar. Ben, real quick, what is hurting you the most?
My back's hurting.
Your back's hurting? Are you having any pain anywhere else?
Not that I know.
Any neck or head pain?
Maybe a little bit on my neck.
Okay, did you lose consciousness at all?
No.
Okay, alright. Can you do me a favor, Ben? Can I see both your hands? Can you squeeze my fingers? Good. Pulses are good. Do you know what fingers I'm touching?
I pointer finger.
Alright, perfect. And you felt all that?
Mm-hmm.
Alright. Can you do me a favor? Check for the pulses on top of the pilio pulses. Push down. Alright, and I'm touching your big toes. PMS is checked before I place him on the C-collar. I'm going to go ahead and size and apply my collar. So with that being said, I would check from the top of the trap to the angle of his jaw. I'll just say he's got 3 fingers. I'm going to go ahead and apply the collar. Before I do that, check for any JVD, tracheal deviation, and go ahead and palpate the back of his neck for any step-offs. Alright, nothing's there. I'm going to go ahead and put this on, partner. We'll just go ahead and move your hand out. You're good. And then just put your hand on the back of his head. Okay. Boom. That's good. Alright, so now I'm going to need 2 other partners. We're going to go ahead and perform the log roll. So I'll have you guys do the log roll, and I'll place him under the backboard. Let me check with these guys, make sure they're
Do you mind crossing your arms? Just go ahead. Yep. Give yourself a big
here.
Yeah.
Yeah? Alright. Alright, is this your old girl? Yeah. Alright. You like 5 minutes, I'm just helping him with something. Thank you, sir. Alright, so on heads count, we're going to go ahead and place the backboard underneath.
The bottom? Wait, on my kid.
Okay?
Alright, 3, 2, 1.
Okay, and while I roll him, I'm going to go ahead and check his back. Hey, Ben, are you having any pain in your back?
Yeah, a bit.
A little bit of pain? Okay, and I'm not seeing any signs of abrasions, not feeling for any step-offs. Back's clear. Alright, let's go ahead on heads count, roll onto this.
3, 2, 1.
Alright, that was smooth. So now, like I said, if you have trouble with the buckles, you can say, hey partner, go ahead and just lift the backboard up and we'll clear the buckles out. So go ahead and clear the buckles out. Perfect. Strap them up. Alright. Let me have you move your hands a little bit for me, please. Thank you, Ben. Alright, Ben, real quick. Need to check your PMS again, okay? Squeeze my hands, alright? Good. Checking his pulses, good strong pulses. What fingers am I touching? PMS is intact in the upper extremities. All right, I got PMS down here. Ben, go ahead and press down. Good. Pull up. Good.
Check it again once
Yep.
you're on.
Yep.
Just in case some like
Something
pinch
moving,
or whatever.
yeah. All right, partner, you can be relieved now. We have him in C-spine. Okay, so I did that, right? We're gonna load him up in transport. When I get in the back, now I'm gonna move into my vital signs. I want a blood pressure, pulse, respirations. I already got my O2 SAP. Just right now. And then you use a sample. I like to use a different acronym, but for you guys, I'll use sample. So, hey, do you have any allergies?
I don't.
Do you have any allergies to medications?
Not that I know
Are you taking any current medications?
of. No.
Do you have any medical history?
No.
Okay, you've been eating and drinking normally?
Yeah.
Okay. So, hey, from what I understand, you were just riding your skateboard, took a fall, you're having some back pain, a little bit of head pain. Nothing else is bothering you though, right?
Yep, that's it.
All right, sounds good. So now I'm gonna perform my detailed secondary exam. Get a check for any VCAP, BTLS, which is deformities, contusions, abrasions, punctures, burns, tenderness, lacerations, and swelling. All right, hey, I'm just gonna check your head out. I would check his head for any depressions, any abrasions, any bleeding. Check his eyes, make sure they're pearl. Check his nose for any signs of bleeding. Hey, go ahead and open up your mouth. I know it might be a little hard. All right, don't see any signs of oral trauma. Don't see any broken teeth. I already checked his neck, so I'm gonna clear that. I'm gonna check his ears for any CSF, cerebrospinal fluid. I don't see any of that. Any pain in here, Ben? Checking his chest for
No.
any instability, any crepitus. Checking his ribs for any crepitus. Checking his stomach for make sure it's soft and supple, no rigidity. I'm gonna go ahead and open the book, close the book, open the book, checking his pelvis for any signs of instability as well. I would check for any priapism, checking the lower extremities using opposing pressures. Okay, any pain in there, Ben?
No.
Okay. I'm down here, I'm gonna check PMS again, just to clear that out. It's clear. I'm gonna move up to the upper extremities, check any PMS, just using opposing pressures, and then I would check PMS again. And then I would fix any secondary injuries that I could have found, so any abrasions, any signs of bleeding, lacerations, splinting. Ben's stable, he's talking to me, vitals are good. I'm gonna reassess him in 15 minutes.
Hell yeah.
Dang.
Thank
That's
you.
good.
Yeah, that was really fun, yeah.
Yeah.
That was really good.
Take that off.
So, if I'm like still looking for like